leo nafikiri ni siku ambaye tuko na referees ambaye sio wa kutoka Isiolo, sio any clan ya Isiolo, sio any political affiliation ya Isiolo, ambao wameletwa na serikali officially, ambao hawajakuja tu kuangalia Isiolo peke yake, wameangalia Laikipia, Isiolo, Marsabit na Moyale, na wameleta matokeo ya hali ya matayarisho ya county ili kupambana na hii ugonjwa ya COVID-19. Na mumeona wameangalia matayarisho tofauti tofauti. Wameangalia hali ya wafanyikazi, wameangalia kuwepo kwa oxygen, iwe ni kwa plant, oxygen plant, ama ni cylinders, ama ni tanks, kuwepo kwa madawa, kuwepo kwa personal protective gear ya wafanyikazi, na mambo yote, kuwepo kwa madaktari na wauguzi, na hali ya vitanda, kuwepo kwa ICU beds. Kwa hivyo tunashukuru leo, hii ni mtihani, na kama unafanyiwa mtihani, na wamefanya hii mtihani kwa wiki 3, hawajatoka hapa wiki 3, wamezunguka hospitali zetu 10. Hospitali kubwa ya Isiolo, sub-county ya Merti na Garbatula, na hospitali zingine 7 za mashinani, ikiwemo Oldonyiro, Kipsing, Sericho, Modogash, Gafarsa na zinginezo 7. Kwa jumla wameangalia mahospitali 10 katika hii county, na leo sasa wamekuja na majibu ya kusema ni kiasi gani sisi tumejipanga, ni namna gani tumejitayarisha kupambana na COVID-19. Kwa hivyo nashukuru leo kwamba wamekuja na wakatuambia ya kwamba sisi kama kaunti ya Isiolo tumepata max ya 85%. Wakiangalia hii paramita yote wakijumlisha, tumescore 85%. Na wakininong'onezea huko chini, wanasema tumefaulu sana katika hii cluster ya Isiolo, Marsabit, Samburu na Laikipia. Na nina hakika hii sasa ni mwanasiasa, nina hakika tuko number 1. Ingawa hawataki kusema. Kwa hivyo 85% hakuna score itaweza kuwa kubwa kuliko hiyo. Kwa hivyo sisi kwanza tunashukuru kwa kupata nafasi ya watu kutoka nje kuja kuchunguza sisi. Hii ni nafasi kubwa sana. Hii ni nafasi Mungu ametuletea, kwa sababu mara kwa mara tunapambana na social media wakitoa picha ya hospitali ya sijui wapi, hata sio Kenya, huko Sudan, na wanaweka kwa social media, wanasema ni Isiolo County. Lakini nyinyi mmetuondolea hiyo lawama. Wanasema tumeiba ama tumetoa ICU beds kutoka hospitali kidogo ya private, na tumekuja kujitangazia na picha alafu tukarudisha. Leo mmetuondolea hiyo lawama. wanasema sisi ni kaunti moja ya ambao haijajitayarisha kabisa, lakini hiyo lawama pia mmetuondolea leo. 85% preparedness done by professionals, not county assembly of Isiolo, ambao ungesema hiyo wangesema hawa ni dabarsa ama namna gani? Hawangekubali. Kama ingekuwa ni Alio ama Wario Galma, hata hawangesikia. Hii ni timu imetengenezwa na Nairobi, imekuja kuangalia kaunti 4 na wametupatia hii hongera kubwa ya kwamba tumejipanga. Hii sio kazi ya Kuti. Hii ni kazi ya wafanyikazi ya hospitali ya Isiolo, health workers ya Isiolo, ikiwemo ni CEC, ikiwemo ni chief officer, ikiwemo ni madirectors, ikiwemo ni madaktari, nurses, mpaka sweeper yule ambaye anafagia chini. Kwa hivyo mimi nataka tuwapigie makofi tukisimama, kwa sababu 85% ni A. Kwa hivyo sio tunanipigia, mnapigia. Let us recognize the health workers of Isiolo County for performing and preparing the health sector readiness for COVID. And today we are rated 85% because of the performance of our health workers. Can we apply for them ili akanu? Moja. Pili, wafanyikazi wa Isiolo hospitali kaunti mzima, asanteni na muendelee kuchunga afya yetu. Asante. Asante sana. Tukae chini. Kwa hivyo hii ni clap to the people who actually have delivered this. It's not me. I just gave the direction. I just gave the leadership together with my team, and the delivery is by the health workers. And I really appreciate them. I thank them, and I'm very happy for their work. And we want to encourage them to deliver even more and to make sure that they fill the gaps that are left, so that next time round we score 100%. Some of the areas we can easily score 100%. The fact that the patient information, the CADEX, is a very easy thing, and I'm sure hapo tungepata hiyo max 5. Kwa hivyo hapo kidogo kidogo tutajaza ili next time ukirudi tunataka kuwa 100%. Mumeona it is one of the county with oxygen plant at the county referral facility and even at the sub-county. And we are going to put even another one at Merti and at Oldonyiro, so that all the sub-counties have oxygen plants, so that the issue of oxygen will be taken care of. I know the politics of oxygen plant is big in Isiolo. Watu wanasema tumeiba, lakini hiyo oxygen hata ilipimwa, imeangaliwa 98% purity, according to the experts who came from the medical engineering teams that came here. So mimi nataka kusema hii 85% ni kwa sababu ya mpangilio ile sisi tumeweka. One area that I challenge this team is you did not, and I think even at a national level this is a failure, that the role of community health volunteers in prevention, in contact tracing, has not been highlighted in this assessment. We have actually put as our first line defenders 703 community health volunteers who are visiting every household in this county. Every household in this county today has a designated community health volunteer who takes care of that homestead to ensure that immunization in that homestead is 100%. Maternal care in terms of visiting antenatal clinics is minimum 4 times during the pregnancy. That deliveries happen in the hands of a qualified health personnel. That health education is given priority as a method of preventing diseases so that people know about diseases, how it is spread, and therefore how to prevent. Basic issues of hand washing after eating, or before eating rather, and after visiting toilet. And those basic things can prevent disease a lot. It is the same program we are in when COVID came, and we converted those community health workers to be our first line defenders in terms of spreading information about COVID, how to prevent COVID, the issue of hand washing, the issue of social distancing, the issue of wearing face masks, and all the health, following the Ministry of Health guidelines. So I think it is deficient when this assessment does not put that into consideration, because it is actually the first line of defense. So I want you to take this message, Chairman, so that in the next assessment, that also becomes one of the parameters to be assessed. But I would like to say that is actually our strategy, that is actually the referral system, number one, isn't it? It's in the referral system, that is level 1, isn't it? So you must look at level 1, you must look at level 2, level 3, level 4, all the way to level 5. So you avoided a very crucial component, which is level 1. I think that is actually related also to contact tracing, which is a very critical management for COVID-19. How is the county prepared to do contact tracing and to follow contacts of positive cases? That, I think, should have been a parameter to be looked at. Well, I would like to highlight on the areas where we were found to be a bit deficient, the issue of mortuary in the sub-counties. I think because of our religion, most of the people in the rural areas are Muslims, other than here in Central. So I think, but still, I think the issue of body preservation is important. We have taken that very seriously. Accommodation for health workers. I don't know why you did not pick that, because we have hired a hotel called Grande Hotel for those who are working at the isolation center at Isiolo referral facility. We do not have accommodation for the others in the sub-counties and other lower facilities, but we have a hotel. We even have divided the hotel into two. One side where negative workers who are just working at the isolation live, and then another wing of the same hotel we have designated for staff who eventually become positive, so that they can be isolated and managed away from the isolation centers, because that was actually their request, and we have succeeded in getting that kind of isolation for health workers. So personally, therefore, me, I'm just a happy guy today, and I want to thank again my health workers one more time. I want to say we are not only working alone. You can see the whole security team is here. The county commissioner, I'm told, is not in town, but we always hold our meetings together. For a few weeks, I've been away because of some personal issues. We have not been having our meetings, which I am hoping to revive again very quickly. But initially, we had a lot of regular every Thursday meetings, and I hope to revive it maybe from next week so that we get back, because also the disease now is rising, and we need to really put the people on alert and let them know that we are still with them. Let them also know that the disease is rising, and if they have been doing social distancing, it is needed more now. If they were putting on face masks, it is needed now more. We have put a lot of hand washing facilities. That's the other area which you could actually have looked at. How are the markets and public places being prepared through hand washing stations? Availability of hand washing stations should actually also have been your other area of, because we really, between ourselves as county government and also donors and well-wishers, we have received a lot of water tanks and made hand washing stations out of them. We have actually even the issue of taking care of the street children. We have removed all under 18 street children and based them in a school somewhere, accommodated them there, feeding them there away from the town so that they don't also fall sick and infect others. So those are also the kind of efforts that we have put in place, which needs to be highlighted, since we are doing a comprehensive preparedness of the county. So those are also the kind of comments you need to go back to so that you also improve your own indicators or parameters. You can add more parameters, and those are the things that we are doing as a county. So therefore, I want to thank everybody very much. I know the media wants me to talk about a little more other things, because right now you are assessing us at a time when we have no money, because the Senate is locking horns on the formula. Personally, I have no preference for any formula. My preference is that all counties should win. A formula that is a win-win for Kenya is the formula that I support. The formula that does not make any county lose is the formula that I support. I do not want this formula to divide Kenya along Mount Kenya, along the former marginalized counties, which were marginalized by sessional paper number 10 of 1965. We don't want to bring back those discussions now. Devolution has actually created a platform that is bringing equity. So therefore, we should respect the Constitution. We should make sure Kenyans are winners, because the citizen in Mount Kenya is a Kenyan. The citizen in northern Kenya is also a Kenyan. And the citizen in any corner of Kenya, in coast, in, Rift Valley or Western or Nyanza, they are all Kenyans. And once we are elected, we are leaders of Kenyans. We are not leaders of Mount Kenya. We are not leaders of Northern Kenya. We are leaders of Kenyan in order to unite Kenya and to bring equity and justice. Therefore, we should support formula that can bring cohesion, that can bring equity, and that can bring Kenyans together. Not any that divides Kenyan along any line, be it regional, religious, or any line. We need unity. We need leadership at this time that unites Kenya and makes, we are in a very tough time. We don't want to add another factor to the already bad situation we have from COVID. So we should just remain united as Kenyans. I really appreciate the role His Excellency the President has played, a unifying factor at a time of hard times. That's when leaders rise to the occasion, and therefore all leaders must rise to the occasion and be national leaders, not leaders of certain quarters or regions or religion or any kind of division within Kenya. So I hope today they are meeting something that is unifying, something that is just and equal, should be able to come out of whatever formula they come up with. They're asking whether politics is playing. That's not my business. My politics is here with the county of Isiolo. Ask me about that politics. I don't know whether politics is playing a role in Nairobi. There was also the question of how the country, my county, is affected. Definitely, all counties are affected by this stalemate because we need resources to be able to deliver to our people. Especially at this time of COVID, we need to make sure that water is available so that people can wash hands. We need to make sure medicines are available so that people can get medications. We need to make sure that ECD and all this other support is ongoing. We need food at this time because the economy is falling apart and people are hungry, and we need to give them food. And all this cannot happen if funds are being held in Nairobi because of senators having a deadlock in the discussion. So it affects us. And there's also how far with plans to increase the isolation beds. It is important that we have brought this up. I want you to know only 10 facilities were assessed. And I think the total number came to, is it 114 or 113? We said 217. But you also heard them saying that they are congratulating us to have spread our isolation beds across the facilities. We have 54 facilities, which means 44 have not been assessed. So when we said we have 217 beds, then you know where the rest are. Definitely we are still behind the 300 mark. We want to assume that our population, we will not be able to fill those beds as quickly as other counties with higher population. But we have plans because we did so well in our assessment. This is not the only area I want to tell Nairobi people. When I came, the Kenya Devolution Support Program is a performance-based World Bank program where you are funded on and assessed on 5 parameters. The finance people are not here to tell us all of them, but I remember finance is one of them, human resource is another, environmental consideration is another, 5 parameters. The year, and people say every now, if I cough, I have to refer to first-term governor. But you know, you have to know where you have come from and where you are at for you to know where you are going. Ama namna gani? The last year of that government is called 12%. And our first year when we came, we converted from 12 to 72%. And the second year we scored 82%. This is always accompanied with the assessment of Auditor General. And the last year of that government is called adverse. In fact, all the 5 years of that term was either disclaimer or adverse. In our first year, we scored qualified. So if you score high in Kenya Devolution Support Program and you get qualified Auditor General's report, that combination earns you bonus. And we got 120 million from Kenya Devolution Support Program because of those 2 performances. And that is the money we want now to use to build the 300-bed isolation, which is coming this financial year. So we are still prepared. We are not at 300, but we are going to build a state-of-art isolation facility. We are not only building for COVID, we are building it as an infectious disease hospital, so that even in future, any infectious disease that comes, we will always be prepared generations to come, not now only for 1 or 2 years of COVID. So that is our plan, and I want to share with you that good story of our performance. Is not only you who has scored us 85%. We've been scored and we are getting better and better. Therefore, we know we have a very vibrant opposition. We have a very vibrant social media. We allow them to thrive. But I also work so hard, and in between their prints, I find out what is true and I correct. That is how I do better. I don't come to bash them. I don't come to take them to the police. I don't throw them. I don't think I've never been to the office of the DCI or to the office of the OCPD or the county commander kusema kuna watu wamenisumbua katika social media. Bwana county commissioner nimewahi. Bwana county commander. Bado, because wacha waendelee kunipiga, lakini mimi natafuta hapo ndani iko ukweli gani ya kubadilisha. They give me indicators of where I should improve. And that is why when such people come, we score very highly, because we respond to criticism that are positive, not fake ones like the ICU ones, ICU bed. Those are fake. Those ones we ignore. But the genuine ones we correct. Sawa sawa? Kwa hivyo tumeongea sana kwa sababu ya furaha. Karibuni tena. We will assure you that those gaps left we will fulfill. But I also want to tell Isiolo people that you are in safe hands as far as COVID is concerned. You are in safe hands. This assessment is not about COVID. This assessment is about the health care of Isiolo people. The success of the health sector in Isiolo is what you have come to assess, because it is all the combination of this that can then give people the services that they deserve. And the Isiolo people deserve better, and we will provide them better service as we have promised them during the time of our manifesto. Thank you very much, and God bless you.
Hallelujah.